Hello there. In today's video, I am going to talk about different settings you can work in as a registered nurse. The first setting is a hospital setting, and even within the hospital, there are numerous positions that you can work in as a registered nurse, or as I like to say, RN for short. The first setting is medical surgical. We usually say med surg. On a regular med surg floor, you can see all types of different patients. You can have a patient that's there for complications with diabetes, a patient that just recently had surgery and needs to be monitored after the surgery, a patient that's there for lung issues, eating disorders, problems with lab values being abnormal, patients that are there with infections that need to come in for intravenous antibiotics, all different types of problems. Patients with broken bones, you name it, you can have those types of patients on med surg floors. And even within med surg, depending on how big the hospital is, those floors can be broken down into specialties. Like you could have a GI floor, gastrointestinal floor. So the patients on that floor, and when I say floor, I mean like a unit. We call them either a unit or a floor. So when I say floor, I mean like a medical floor. When we say unit, to me, I say unit meaning like the ICU, the intensive care unit. So if I refer to a floor, I'm talking about like a regular medical floor. So even within med surg, you can have specialty floors. You can have, like I said, a GI floor where patients are there for kidney problems, floors that are for patients who are having cardiac issues. And even with cardiac, you can break that down into a telemetry floor, where telemetry floor, the patients are hooked up to heart monitors. There is like a central monitor desk where a staff member is watching the rhythms for each patient. Depending on what's going on with them, they may be receiving certain medications that we have to watch their rhythm, or their heart could be to put it in layman's terms, their heart rate, their heart rhythm could be out of alignment. So we put that heart monitor on them to watch their heart rhythm. And depending on what heart rhythm they're in, they have to have certain medications. So that's a floor within itself. Another floor is a surgical floor, where patients who need surgery or have had surgery are on that floor. And even within surgery, there's different types of surgeries. Like a lot of times people who have broken bones, we call those, and need to have bones fixed, we call those orthopedic patients. So you could be on an orthopedic floor. And not every hospital breaks their medical surgical floors down to specialties. Like I said, it depends on how big the hospital you work in is. The first hospital I worked in, yes, the floors were broken down into specialties, but this was a big, huge hospital. The hospital I currently work in, it's not broken down. So a lot of those subspecialties are all together. So another area you can work in the hospital setting as a nurse is the ER, or emergency department, where people come in for all types of reasons. Some people come in and it's not a true emergency, but they use the emergency department as their care provider. And then like true emergencies, like someone is coming in, they're having a stroke, a heart attack, a trauma, like maybe they fell off a ladder, all different types of reasons. They had a really bad car accident. Someone may have fallen and hit their head and they have bleeding in their head, all different types of reasons. I've had people come in because they broke a nail, and not like down here, but like this part came off, and they came in for that. So yeah, so people's interpretations of emergency is different. So you still have to be professional and treat everyone. Another area in the hospital setting is the intensive care unit, ICU, or some of us call it the unit. And even within ICU, you can have a medical surgical ICU, where a person is really sick and they have to be hooked up to a machine to help them breathe, and they have to be on medications to regulate their bodily functions, like a medication to regulate the way their heart beats, all different types of medications, a medication to sedate them so their body can heal, so we can give them certain medications to help their body heal from whatever is going on, all different types of reasons. Someone who may be on a medication that we have to watch closely, that may affect their heart, lungs, you name it. So those are the types of patients that you have in the ICU. Also, another area, depending on the hospital, not every hospital has these types of units. Some hospitals have maternity wards, some don't. So another area that you can work in the hospital is labor and delivery and what we call mother baby. So labor and delivery is just that. You have mothers that are coming in labor and they deliver their baby, and then they go to what we call postpartum or mom baby. So they go there with their babies, and then unfortunately some women come in that are having a miscarriage and they go to the labor and delivery department, and then they also go to postpartum. So that's another area of the hospital that you can work in. And then another area is surgery, where even within surgery, it's broken down to different areas. So you have the actual surgery, we call it like a surgery suite, where the nurse is in the operating room or the surgery suite. You have so it's an OR nurse operating room. And there's even different levels to the nurse that's in the operating room. You have a nurse that circulates. Let's say this doctor needs a special medication, so we call it like a circulating nurse. And correct me if I'm wrong, because I've never worked in the OR, but I have friends that have worked in the OR. So if I'm misspeaking, let me know in the comments. But there's like a circulating nurse. Let's say a doctor needs a medication or something. That circulating nurse gets that medication, or like they're doing a surgery and they have their instruments laid out, but they need a different instrument. That circulating nurse will get that instrument for the doctor, the surgeon. There's also a first assistant where they work closely with the doctor, the surgeon. They help assist with the surgery, like they hand the surgeon different instruments that they need. They do all different types of things. I've never worked in the OR, but the first assistant assists the surgeon. So another area that you can work in a hospital setting is employee health, because there are certain criteria, there are certain things that employees need and able to work in a hospital setting. So an employee health nurse is there to make sure that medical criteria are up to date with the employees at the hospital. And if you are injured, depending on the severity of injury, if you're injured at work, if it's real serious, you go to the emergency department. But if it's not, you would go to employee health to be treated. So there is employee health nurse. So another area in the hospital, and like I said, some hospitals have this department, some don't. And then there are some hospitals that this is their only specialty, which is pediatrics. So depending on how big your hospital is, you will have a pediatrics department, and pediatrics is for children, babies and children. Like 18 and under, they go to the pediatric area. Even within pediatrics, you have different settings like the neonatal intensive care unit. Just like the med-surg floors I was telling you about, a child has a broken bone and they need surgery. They may be on a medical surgical floor, or depending on how big that hospital is or that pediatric department, they may be on like an orthopedic floor. Children have many of the same issues that adults have, but they are treated differently because there's different things you have to do for children. So they have different specialties for a pediatric department. Let me also, with the intensive care unit, let me backtrack a little bit. So even within intensive care, there's a lot of different specialty subsets. So like I said, and this depends on the type of hospital you work at. The hospital I work at now is pretty small, so there's only one intensive care unit. But the hospital that I started at had an intensive care unit for everything. Like there was a cardiac intensive care unit, med-surg intensive care unit, neuro, which is your brain. If you had a brain injury or something was going on with your brain and you needed closer monitoring, you would be in the neuro intensive care unit. Let's say you had heart surgery, like open heart surgery. There was a cardiothoracic intensive care unit. There was an oncology intensive care unit. So each specialty can be broken down into subspecialties. I mean, it does, like I said, it just depends on how big and specialized the hospital you work. So that's just the hospital setting. There's many other settings you can work in as a registered nurse. The next is primary health care, where you work in clinics. Like, let's say you have diabetes and you could work in a diabetic clinic with patients. You would do a lot of diabetic education and teaching. Education is the same thing, but you just monitor the patients. You go over diabetic teaching, diet, how to give insulin, how to check blood sugars. There's also allergy clinic, where you test people for different allergies. A primary care, where you go in to see the doctor. A lot of nurses don't work in like the doctor's offices anymore. Usually those are medical assistants, but some doctor's offices do have registered nurses or licensed practical nurses, but most of the time those are medical assistants in there. Let's say you need to be on a blood thinner. You would go to what we call a Coumadin clinic. With Coumadin or warfarin, it's a special blood thinner where you have to be monitored. You have to have like certain labs to make sure that you're in a therapeutic range. Therapeutic range means the range that's therapeutic for your health. Basically, that's a good way to explain it. Hopefully you guys understand what I'm saying. Let's say you have congestive heart failure. There may be a congestive heart failure clinic. A lot of times those patients need teaching on how to monitor their weight, monitor their salt intake, medications. So there's all different types of clinics. Another area you can work in is public health, which public health can kind of coincide with a clinic setting. Usually they are in a clinic setting. They could work for the government. Let's say there are outbreaks somewhere. Public health nurse would monitor those outbreaks and see the patients and collect data for statistical data to monitor the outbreak. Disease prevention, like a public health nurse may go into different settings, like maybe community centers or something, and talk about preventative health measures like healthy diet, how to check your blood pressure and things like that. They may go out and do like blood pressure checks in like churches and different community settings. They go out and give flu shots, like maybe a flu shot clinic. So that kind of falls into public health. And then there are long-term care facilities. Even long-term care facilities can be broken down into different categories, like what they used to call convalescent homes. They kind of gotten away from calling it that. So even we call them skilled nursing facilities now. So even within a skilled nursing facility, you have patients that are there for like rehab purposes. Like you go into a skilled nursing facility for a skilled nursing need, like for a skilled need. Like you need, let's say you had a fall and you had surgery. You need to have physical therapy to help get your strength back, occupational therapy to relearn how to like put pants on, how to use the bathroom, how to brush your teeth, things like that. So you have a skilled need for that. Let's say you have trouble swallowing. You go into a skilled nursing facility to have speech therapy from a speech language pathologist. And also, I'm going to do another video on other healthcare professions that registered nurses work closely with. Like I named three just three three just then. I named physical therapists, speech language pathologists, and occupational therapists. So I'm going to do a video talking about the other disciplines that registered nurses work with. But anyway, back on topic. So patients go there for therapy. Those patients they don't stay there long. They usually stay like a week or two to get their therapy, and they move on to the next level, like they go back home or wherever. And then there's patients who are sick and aren't able to live in other settings. So they live in a skilled nursing facility or a nursing home. They live there. So obviously, because you have patients there, you have nurses there. Usually nurses in a skilled nursing facility, they have more of a patient load versus the nurses in the hospital, because yes, the patients are sick, but they're not acutely sick. Like, we're not necessarily giving them IV fluids. We're not checking their blood, their labs every day. We're not doing all these procedures on them. They are there to get healed from an illness in order to go home, or they have like a long-term illness that doesn't need to be treated acutely, and they live in the nursing facility. There's also, gosh, the more I think about it, I could do a video on each of these topics, because even within like long-term care, there's different levels to long-term care. So I'll have to do a video about that. Like, there's skilled nursing facility, there's assisted living, independent. Oh my gosh, I'll have to talk about that in a video too. I'm just coming up with all these video topics. But anyway, okay, so next, something else that a registered nurse can do is be a home health nurse. I personally, when I was a travel nurse, I did work in home health. Like, they needed help in home health, and I said, why not, get some more experience. I absolutely loved home health. The only thing I didn't like about home health was the driving, because I don't really like to drive. But I really liked home health. The patients were so appreciative. I was able to do a lot of teaching, and I spent a lot. Well, I didn't spend a whole lot of time, because you usually are there for like 30 minutes. And not even every day. Like, you usually go, just depending on what their needs are, you go 2 to 3 times per week for like 30 minutes. But I was able to have one-on-one time with the patient and really just kind of take care of them, do what I needed to do, educate them. And they were really, really, really appreciative. I never had a patient who was angry because I was there helping them. So, and I know maybe some nurses have had that experience. I never had it. I always felt really appreciated as a home health nurse. So next is school nursing. I never did school nursing, but when you're in school, there is a school nurse. And depending on how big your school is, you have a school nurse there full-time or part-time. The schools I went to were kind of smaller, so we had a school nurse like at the beginning of the year when you had to do your physicals and all that good stuff. The school nurse was there. Otherwise, we didn't necessarily have a school nurse. But some schools that are larger, you do have a school nurse there. So if your child is sick at school, the teacher will send your child to the school nurse. And even with school nursing, it is considered pediatrics, but you still have to know a lot. You have to know about all different types of diseases, because just because it's a child doesn't mean that they don't have like a chronic illness like diabetes or asthma or, epilepsy. So there's all different types of illnesses that you can think of with an adult population that are present in pediatric population. So school nurse, hats off to you, because you have to do a lot of critical thinking to figure out what's going on with this child. And it's just you, like, you don't have the support of like a doctor being right there or another nurse colleague or, so hats off to you school nurses. I never did that. I admire you all. So there's also occupational health. Like I talked about in the hospital, like the hospital employees are sick or something, depending on the severity, they would go to the employee health nurse. Well, certain businesses, depending on how large they are, they have an occupational health nurse. Let's say you have a on the job work injury, you would be followed by the occupational health nurse. They would kind of dictate what type of, along with a doctor, but they would dictate where you need to be seen for your work injury. They help with workers' comp claims, filling out the appropriate information for the employee. A lot of times they'll do investigations to see what happened. If there's process improvements, they document what happened. They make sure that you're going to all your appointments. So things like that. So that's an occupational health nurse. Inside a hospital or outside of a hospital is mental health nursing. Mental health nursing. Some hospitals have mental health areas, some don't. And there are some mental health facility, like standalone facilities. So like I said, it really just depends. It depends on how big the hospital is. The hospital you work at may have like a mental health section. And then there are some like standalone mental health facilities. So a nurse there, they would take care of patients who are having a mental health crisis or a chronic mental health condition. So they would go to those types of floors or those types of facilities to be taken care of by a mental health nurse. And usually the mental health nurses, they are under the physician, but the physician is a psychiatrist. And then depending on what's going on, you would have a psychiatrist who is a medical doctor, or a psychologist who has a doctorate in psychology, but who's not a medical doctor, but they still have a doctorate. So it just depends on the setting. Another area, oh my gosh, guys, there are so many different areas of nursing, and I'm sure I'm not even naming all of them in this video. If you can think of any that I haven't named, put them in the comments below. So nurses can work in academic settings, areas or schools or businesses that conduct clinical trials. Nurses work in those areas, conducting clinical trials, research, data. Let's say there is a new medication and you go in for a clinical trial with this new medication or a new procedure. You would see a nurse there who would monitor you, administer the medication, document what's going on with you. You fill out surveys. They'd ask you a bunch of questions. Like I said, I haven't worked in that setting. So correct me if I'm wrong. If there's more to it, tell me in the comments so everyone can see. So I'm just kind of, naming things that I know about. Some areas I know more about than others. So there we go. So that's research and academia. Another one is telehealth. So this is fairly new. So telehealth nurses, from my understanding, from what I have seen, let's say there is a rural hospital and they have an ICU unit. So you would have a physical nurse there, but you would also have like a telehealth nurse where they also see all the medications you're on. They're checking your heart rhythm. They're making sure you're okay. Like there's cameras in the room, and that nurse will come on camera and monitor you from that. They're kind of like a backup nurse. And like I said, it's more from what I've seen, like smaller hospitals. I take that back. I have seen telehealth nurses in larger hospitals. It just depends. Telehealth is fairly new, and they're usually critical care nurses that do telehealth, I think. Well, yeah, they're critical care nurses that do telehealth. And that's my understanding of it. There may be other applications, and like I'll say throughout this whole video, if there's something else that they do, write it in the comments. Hospice and palliative care. So palliative care nurses, they can be in an inpatient setting and an outpatient setting. So when I say inpatient is in a hospital setting. Outpatient is in like a clinic setting. So they can do either or. Palliative care nurses go kind of help guide patients through what they want their health care to look like. Let's say there's someone who has a chronic illness and it's getting worse and they keep coming into the hospital and being treated. and they're like, I'm tired of doing this, or I want to be treated, but I only want certain things done to me. I don't want all this testing and everything. So they kind of help guide the patient on their care plan, like on how they want their care to be received, basically. And then hospice nurses, they take care of patients who are at the end of their life. They usually have 6 months or less to live, and they help make that patient comfortable. Most of the time, hospice patients are in their own home or in like an assisted living setting, a nursing facility. And they help assist that patient to make them comfortable when they transition. Informatics nursing. Informatic nurse is someone who works on like computer systems, basically. So when you are in a clinic setting or a hospital setting, most hospitals now have electronic charting, like Epic, Cerner, McKesson. I think there's McKesson, but they have like charting systems. So you need nurses to kind of help troubleshoot and help build those systems. So that's where informatics nurse comes in. It's like an IT nurse, information technology nurse. That's where that person comes in. So the informatics nurse, they're registered nurses, and they go back to school to learn additional information about information technology. And then you have military nurses that are in the military that help care for the military personnel. There's another area that I just thought of off the top of my head is cosmetic surgery. There are nurses that work in cosmetic surgery offices, giving certain cosmetic treatments and assisting with surgeries. Like I said, like the OR nurses, there are nurses that help the plastic surgeons perform surgery. That the circulating nurse and the first assistant, it's surgery, so they need nurses to help with that. So, and if there are any other, there's another area that I've totally forgot to talk about, and that's what I do as a registered nurse: case manager. So basically, a case manager, we help coordinate long-term planning for patients, like discharge planning. We also deal with insurance. There's all types of things we can do. We help manage like complex care for patients. Like, let's say a patient comes into the hospital and they broke a hip and they have to go to a skilled nursing facility. A case manager that's an inpatient, they would help facilitate that patient going to the skilled nursing facility, or if they need certain equipment, they need home health, they kind of help facilitate that. And then also there are certain insurance standards that the hospital have to meet. There's certain things that you have to do for insurance. Like there's certain information that the insurance company wants, certain benchmarks, certain, what you would say like a care plan. Like let's say you come in for congestive heart failure, there are certain things yet need to be done to you while you're in a hospital. The insurance wants to make sure you're receiving that type of care. So the case manager relays this information to the insurance companies. So that's case management. And I'm trying to think what else. I think I've touched on most of the areas you can work in as a nurse. There's all different types. Oh, well, to kind of piggyback off case management, there are nurses who work for insurance companies where they are making sure that their patients are receiving the type of care that they need, and when they're ready to discharge from the hospital, that they're being discharged appropriately, discharged when they're ready, following up with that patient to make sure they understand what's going on, make sure they're taking their medications correctly, make sure that they're doing preventative things to help to keep them healthy. So yeah, and a lot of those nurses that work for insurance companies, those are the work from home jobs. There's some that, there's other areas that nurses can work from home, but traditionally, and from what I know, in nurses that work for insurance companies, a lot of them can work from home. So if you want to work from home job as a registered nurse, maybe think about getting into case management. But as a case manager myself, you absolutely, in my opinion, have to have medical experience, like hands-on experience, because you need to know like the big picture of what's going on with that patient. But anyway, don't get me started on that. So thank you so much for watching my video. And like I said, if there's any areas that I forgot, if there's something that I explained that I didn't explain correctly, tell me in the comments below and we'll talk about it. Thanks for watching.